This is my friend Lynn, Lynn Leach.
Lynn Schulte.
Lynn Schulte Leach. Yes, yes. And we go way back. Lynn used to help me when I would teach my Sacroiliac workshops in Seattle. Yeah. And she's since moved to Colorado. She's right outside of Boulder. And I live in Aurora. I moved out here 3 years ago. And so we just reconnected this evening. And so we've been sharing lots of ideas and techniques back and forth. And I thought I would have her talk about her work. And then at the end of the talk about how my work has influenced her work. And she's doing some really exciting stuff for pregnant women and post-pregnancy recovery. Yeah, and here she is.
Hi, I'm Lynn Schulte. I'm a women's health physical therapist, and I'm the founder of the Institute for Birth Healing. I have been working with pregnant and postpartum women exclusively for the last 10 years, and I found a very common birth pattern that happens in the pelvis. And it's really, truly, the work that I'm doing with my pregnant and postpartum women really does start from the work that I learned with Jerry back in the early 90s. Just the mobilization and the way Jerry approaches the springing of the pelvic bones. I've been able to use that work as a foundation for helping my moms recover from pregnancy or recover from birth, and also help their pregnancy be much more easeful. And so I'm just so completely grateful for the way that Jerry taught his work, because it was actually not only the mobilizations of the sacrum, but his approach to the bone that actually helped me to feel and be able to evaluate the bone in the pelvis, and whether the bone feels springy or whether it feels hard. Was really foundational in helping me to determine the birth patterns that I'm finding in the pelvis. So the Hesch method is what I use daily in every single client that I work with, and have been able to really feel and appreciate what the body goes through to get a baby out. And I've been able to bring in my visceral manipulation skills and my craniosacral skills, and be able to help moms heal more completely after birth. And it is my hope and dream and goal is to bring the Hesch method work to pregnant mamas, so that we can evaluate the mobilization skills or the ability of women's pelvises to mobilize for birth, and get all women evaluated prior to going into labor so that moms can have an easier birth. The bones in the pelvis need to open, and we can assess that through Jerry's mobilization techniques to make sure that the pelvis can do so. And so I am extremely grateful for Jerry's skills and the knowledge that he puts out there around the pelvis, around the whole body, really. It's just amazing. He just got done working on my neck, and I feel amazing. And I have more mobility that I didn't even know was restricted in there. And that's what I really love, how he brings that mobilization technique to the body and assesses the body should move, and then when it can't move, there's a dysfunction going on, and we need to figure out how to get that body, that part of the body, moving again. And Jerry is just brilliant at that. And so it's been wonderful to reconnect after all these years and get to share our new learnings, because we're always learning about the body and what it needs to do in order to heal. So I can't highly recommend Jerry, the Hesch method for treating of not only the pelvis but the whole body. Is just phenomenal work. So thank you, Jerry, for the work that you do, and for being the foundational impetus for the work that I'm doing with the Institute for Birth Healing. Thank you.
And so that is your website, the Institute for Birth Healing.
InstituteForBirthHealing.com, and you can find us, that's the website. You can find us on Facebook. I have a thriving Facebook community, Institute for Birth Healing Community. If you want to join us, please join there. I also have a bunch of videos on YouTube for the Institute for Birth Healing, so you can find me everywhere.
And so you freely share information
absolutely.
about your work.
Absolutely.
You do have a workshop. You have a couple of workshops.
Yes. So I teach practitioners how to help moms heal and prepare their bodies for birth. So I have a holistic treatment of the pregnant body course. I have a holistic treatment for the postpartum body course. And then I also have a certification program where I have women, you have to take both of those courses, and then I also have an advanced training that works more energetically, emotionally, in releasing the trauma from the body. So that's what's covered in the advanced training. But you can become certified as a birth healing specialist. And my dream and goal is to have a certified birth healing specialist in every city in the world, so that I know that women will be getting the care that they need after having a baby.
And you started out by taking your work to Moscow.
Yes, yes. I currently have 30 birth healing specialists in all throughout Russia. I have one in Switzerland, one in Germany, one in India. And I just had someone come over last weekend, and she's from Australia. So the work is starting to spread and get out there, and I'm super excited.
Nice.
Yeah.
And then just to summarize again, you approach your women with a variety of techniques. So we know you use Hesch method.
Yes.
We know you use some visceral work.
Yep.
We know you use some craniosacral work. You
Yeah.
do exercise. As a PT,
Absolutely.
you surely do
Yeah.
exercise. What else? Am I missing anything?
Well, I also do internal work. So
Right,
I work
right.
with the pelvic floor muscles and get that released. I feel like that's foundational, is being able to release those pelvic floor muscles, especially after birth. Tearing and scar tissue, hemorrhoids, fissures, all those kinds of things can easily be helped when we do internal work with those tissues. So I do a lot of soft tissue mobilization and techniques. I'm getting loved on
That's
by
Lola. She's a 1-year-old puppy.
that wants to be a part of this. So yes, I do, and then a lot of core strengthening.
Yes.
Re-strengthening of the core after having
Sure.
a baby. That is critical.
And do you find it easier? There's less inhibition, maybe?
With what?
There's less inhibition of the core.
Oh,
Once
absolutely.
you balance structure.
Yes, absolutely. And also getting those pelvic floor muscles released.
Yes.
The pelvic floor muscles have got to move, and also the ribs, I use the Hesch method of just mobilizing tissue to see what moves and what can't move, and work on getting it moving again. And that's really helpful for the core and the diaphragm, and getting that moving after birth.
Very good.
So, yeah.
And so one last time, the name of your institute.
Institute for Birth Healing, so instituteforbirthhealing.com. You can find, that's the website, YouTube, Facebook. Please join in and check it out.
And are you in Loveland or are you in Boulder, Colorado?
I am in Boulder and Denver. So
Okay.
I come down to Denver and
Very
see
good.
women, and I also treat in Boulder as well. And I'm teaching all over the world, so. Yeah.
Nice.
Yeah.
Maybe I'll have to go to Moscow.
Yes, there you go.
Thank you very much. I
All right.
appreciate it.
Thank you, Jerry, for the
And
work
I'll-
you do.
Sure, and I'll just say that lastly, my last name is spelled H-E-S like Sam, C-H. It's Hesch Institute. Thank you very much. Appreciate it. Grateful.
Yeah, thank you.